Self-hypnosis for neuropathic pain. Clinical hypnosis is the application of hypnosis to problematic states of the body and mind, led by a health professional. Hypnosis is a concentration of all your inner resources that you will draw on in a perhaps more fluid, perhaps more profound way. Your attention will focus on aspects of yourself that you usually do not pay attention to. All the resources, tools, and healing capacity within you will be brought into focus in a much more specific way. You can stop this recording at any time you wish, in case the experience is unpleasant. During this practice, you will continue to be aware of what is happening inside you and also outside you. You're not going to be driven to anything that's not desirable for you. You will not lose contact with the outside, but the external elements will lose strength. They will be more distant, more muffled. Find a place to settle down. Let your body adopt a comfortable position. Notice where your body is in touch with the seat, cushion, the sofa. Let your body settle and sink so that you can perceive the connection with the earth. As your attention moves through your breathing, noticing this oscillating movement in your abdomen, in your chest. By breathing in, you introduce air into your body, oxygen which increases the nourishment of all your cells. The tactile sensation increases. It becomes more intense. As you observe how the substances you do not need are expelled through the trachea, the nose, spread into the surrounding atmosphere, you will feel a slightly different sensation in your hands, perhaps in the right or in the left, when the lightness or maybe the heaviness of the air that you introduce into your body has been transmitted to one of your hands. Will this hand have the desire to separate from your body or from the armrest of the chair? As the lightness lifts your lighter hand up and you can notice how the other one becomes heavier, you can turn your head towards the hand and opening your eyes, you will notice this influence, this energy coming from your eyes and attracting the hand towards them a little more. And when the hand has reached a higher height, then you can let it drop down and bring your head back to the center while you leave your eyes shut again. And the hand slowly reaches the armrest or your body. And when it gets there, you will be completely absorbed. Imagining the outline of your body as if it were drawn on a blank sheet of paper in front of you. Imagine the contour, the curve of the shoulders, the arms, the curve of the waist that opens into the hips. The lines that circumscribe the legs and your feet. And then go back up and imagine the contour of your head, your profile. You can notice how this figure, this silhouette, becomes three-dimensional, as if it were a holographic photo. Visualize or feel the energy that emanates from your skin. And inside, notice your nervous system, starting from your brain, slightly bean-shaped, from which the spinal cord originates. That goes down inside the center of the neck, of the thorax, of the pelvis, to the end in the sacrum and the coccyx. Imagine all the nerves that originate from the brain, the encephalon, and from the spinal cord, passing through the spaces between vertebra and vertebra. Those that come out of the base of the skull and innervate the face. Those that pass through the cervical joints and innervate the arms. Those that come out of the intervertebral joints of the thorax, innervate the thorax. Those that exit between the lumbar vertebrae, innervate the pelvis and the legs, down through your legs and the feet. Those that exit from the sacrum, which innervate the gluteus, the ischium, and the genital organs. And see what color does your nervous system appear. What color do you visualize? And go to the area where you experience the pain and see what color you imagine there the nervous system to be. The innervation, the thickest nerves and the branches that become thinner and thinner. And if the pain affects most of the areas of your body, imagine what color all these innervations are that carry the pain signal to the areas where you perceive it. Just notice the difference of these peripheral colors, of the nerves carrying the pain. The difference of this color with the color of your calm brain. Now that your body has abandoned itself to the stillness, notice that this color is certainly paler, certainly less intense. This color that you can see from behind your eyelids. When you let your eyes sink behind your eyelids, let this pale color run through all the channels where it's necessary. Through the neck, shoulders, arms, fingers, or maybe further down through thoracic spine, the lumbar area, and from there to the legs and feet. And down to the sacrum towards the genital organs. Observe how the color of these areas of discomfort turn pale. Just give it time to occur while your brain is still busy interpreting harmful messages. See how the right half of your brain can send the color of calm, the color of stillness all the way down to the spinal cord. And from there, penetrating into the nerves of the arms and hands, leaving them completely pale and calm, or to the trunk and pelvis, bringing a sense of stillness and deactivation, penetrating through the legs and even reaching the feet. Let the deactivation mechanism take its course, letting the color a little paler, perhaps even close to a white, a green white, a yellow white, a pink white, a great white, an indifferent white, an indifferent gray, a white gray, indifferent to these danger signals that are no longer dangerous. This white gray can be indifferent because while one side of your brain can still continue to read certain stimuli, certain events outside or inside you as a sign of threat. The other part of your brain, the other side, feels that it can be indifferent to this stimuli, that are only a memory, a vain repetition of distant situations. So, while the first side of your brain still observes the memory, the one that perhaps is a little activating, the other part of the brain can dedicate itself to turning off these connections, those that are not necessary. These connections between neuron and neuron, between nerve and nerve, the synapses between nerve ending and nerve ending. Because there is no longer any need to be on alert. There is no longer any need to raise an alarm, but just to take care. To take care of these nerves endings that have worked so hard and that now want to dampen the intensity of their activation, to bring this warm or cool and calm color. And while you let the other part of the brain witness this process, so that it becomes aware, and you can remember that now there's no reason to be alarmed. Only in case it's really necessary, this part will continue to activate. This part observes a pink-white or a great-white or yellow-white color towards all the extremities and all the areas of the skin where there's a need for a balm, a care, a relief. And now, let this feeling of quiet, of relief, of calm spread throughout your whole body, through the nervous system network. It is known how this needs breath on the level of lungs. Let everything that you have found and that is no longer useful for you come out through your breathing. And when you take the air in, let the quiet be infused to all the cells of your body, to all the cells and parts of your body. Just carrying with you this sensation of quiet, of care, of relief. Every time you inhale, you participate in this diffusion, spreading of the quiet throughout the body. And every time you exhale, all that information and sensations that you do not need goes out with the air. So now, regain contact with your hands and feet. Bring in a little movement. Meanwhile, revitalize your body thanks to breathing. Revitalize your arm, your legs. And on the next exhalation, you will gently open your eyelids.